session?
Yeah, I think it's every time 10 times enough, and once a week. And this is not a massage. It's not concerning about the muscle. This is the trying to send a signal from their sensory organ to the central nervous system, transfer to the motor neuron. So we don't need like exercise, you know. Exercise need every day, right? After age of 18 or 20, and then when you decide to go into the surgical treatment, the lot of length have to be pulling back, set back. So that means is reduce the airway narrowing. See, this pulling all maxillary component is to recovery, to get enough space for airway. So if you remain, if you didn't treat anything during this age, also small maxilla has a narrow airway. So put them forward, and put the expand is not only for get enough space for teeth, also to get enough space for airway. Did I answer to your question?
You're saying that what you're doing is going to increase the airway, even in a class still with class 3?
I'm talking about class 3 on the one side surgery, but if you had both upper and lower, you have to have by surgery to maxillary have to be moved forward. So might be avoid one surgery. So that's my answer.
In that last patient where you brought the maxilla forward, and you finished it in a nice class 1, would you have rather finished it in a mild class 2? Because in my experience, this type of patient tends to regrow a class 3 somewhat.
Yes, that's a good question. Who knows? The secondary growth.
I always try to overtreat those patients.
Yeah. So even after growth, we see the first step treatment is to arrange the maxillary part to the skull as much as you can. So secondary growth gonna happen later. I don't know. Set it back and get enough space for airway to survive after the whole life. So that is the main reason. Another reason to give you. Thank you very much for patient a long time.
So, Dr. Nakajima,
Hey, Greg.
thank you so much for giving us a different view of orthodontics and from across the ocean, and giving us some ideas to ponder. Here's a certificate in appreciation of your talk today.
Thank you very much.
We look forward to seeing your afternoon presentation.
Yeah. So, thank you.
So.